Hello everyone, this is Sapna from RPIIT Medical and Technical Campus. In today's class, we are going to discuss about regulation of blood glucose. So, regulation of blood glucose, in previous classes we have discussed about glucose, and we know that glucose is a carbohydrate, it's a type of carbohydrate. And in this video we are going to study how this glucose is regulated in blood. First of all, we will discuss about the normal values of blood glucose. So first of all, we will discuss about fasting value of blood glucose. Fasting value of blood glucose is 70 to 100 mg milligram per deciliter. According to WHO criteria, this is more than equals to 126 milligram per deciliter. Then we will discuss about the postprandial value of blood glucose, and it is up to 140 milligram per deciliter, but according to WHO criteria it is more than equal to 200 milligram per deciliter. Now, then we will discuss about random blood sugar, or we can say random blood glucose, that is also above 140 milligram per deciliter, but according to WHO criteria, this glucose level is more than 200 milligram per deciliter. If the glucose is high, then it is known as hyperglycemia. Here, high means above normal range but high. This is a condition which is known as hyperglycemia. Hyper means increased or above normal. Glycemia means glucose present in blood. If the glucose is lower than normal value, it is known as hypoglycemia. Blood glucose is mainly regulated by two hormones known as insulin and then glucagon. Now we will discuss about these two hormones, insulin and glucagon. Insulin is secreted by beta cells of pancreas and helps glucose to enter cells. Glucagon is secreted by alpha cells of pancreas and it helps in maintaining the glucose level in blood. These two hormones maintain within the physiological limits by the rate of glucose entrance into blood circulation and the rate of removal from blood circulation. Now we will discuss about the symptoms of hypoglycemia. Symptoms of hypoglycemia are tiredness, confusion, dizziness, headache, mood serves, muscle weakness, tremors, cold, sweating, irreversible central nervous system damage, coma, and even though death. Symptoms of hyperglycemia are excessive thirst, frequent urination, fatty, weight loss, vision problems such as blurring, susceptibility to interfere with diabetes mellitus. The rate of glucose enters into the blood by absorption of intestine, hepatic glycogenolysis, gluconeogenesis, glucose obtained from other carbohydrates like fructose, galactose, etc. Rate of removal of glucose from blood depends on oxidation of glucose by tissues to supply energy, hepatic glycogenesis, glycogen formation in muscles, conversion of glucose to fats in adipose tissue, synthesis of fructose in seminal fluid, lactose in mammary glands, formation of ribose sugar and nucleic acid synthesis. Now here we can understand the regulation of blood glucose, how glucose remains normal in blood. First of all, there is increase in blood glucose level, then our beta cells of pancreas releases insulin into the blood, which increases the uptake of glucose in body cells and liver, and then the level of glucose become normal in blood. In its reversible, there is decrease in blood glucose level. When there is decrease in blood glucose level, then our alpha cells of pancreas releases glucagon hormones into the blood, which increases the breakdown of glycogen and releases of glucose into the blood. And in the same way, here also the level of blood glucose becomes normal. Thank you.